everyone, so let's move towards our today's topic, which is
second part of the small intestine. And we have already discussed in the part 1 lecture that duodenum, what is small intestine. So now in this lecture we will gonna talk about further, which is duodenum, ileum, and nerve supply of the small intestine and the blood supply of the small intestine. Now duodenum, like I said, the fourth part of the duodenum will end at the duodenal junction. Okay, now after that duodenum will form, the small intestine, the part of the small intestine is called as duodenum. Now it is the second part and it consists of many folds. Now if someone asks you why the folds are present in the small intestine, okay, so the answer is to increase the surface area. Okay, and the whole mucous membrane consists of finger-like projection called as villi. Villi are also present, so that more surface area to expand the to have a greater surface area, they are forming folds. Okay, and obviously, as you know, small intestine will help a lot in the absorption of the nutrients. Okay, now like I said, second part of the small intestine, it consists of many coils. The difference, because many professor will ask you that what is the difference between duodenum and ileum. Why they ask? Because like I said, duodenum and jejunum are meeting at the junction of the duodenal junction, and when you will do surgery in future, you will see clearly the demarcation point between the jejunum and the duodenum, but you will not be able to see where the jejunum meeting with the ileum. Why? Because the jejunum and ileum are pretty much similar. There are some differences, but from jejunum till ileum, the jejunum and ileum are gradually changes. Okay, what does it mean? जैसे jejunum है डबल वॉल लेयर, ये अब आपने याद रखना, डबल वॉल होती है. अब आहिस्ता आहिस्ता वो डबल वॉल लेयर सिंगल वॉल बन रही है, तो वो आहिस्ता आहिस्ता जो बन रही है ना, दैट इज कॉल्ड एज ग्रेजुअल चेंजेस. दैट ग्रेजुअली जो चेंज हो रहा है, दैट विल चेंज इनटू इलियम. हाँ, इलियम में आप कह सकते हो कि इलियम विल एंड एट इलियोसिकल जंक्शन, बट इलियम और जिजेनियम का डिमार्केशन पॉइंट कोई नहीं है, किसी बुक में नहीं लिखा हुआ. ओके, नाउ जिजेनियम इज रेडिश इन कलर बिकॉज ऑब्वियसली रिच ब्लड सप्लाई होती है, वस्कुलेचर होते हैं. एंड इफ आई टॉक अबाउट इलियम कंसिस्ट ऑफ मैनी विलाई. Jejunum also consists of many villi for absorption. The whole intestine consists of many villi. So the point is, ileum consists of few villi, but those villi are spread on a larger scale. Okay, they are separated widely, and it consists of many lymphocytes, and that collection of the lymphocytes are called as pairs patches. This is very important point. What is lymphocyte? Lymphocyte are the leukocyte WBCs. Okay, now ileum is single layer, and it is the third part and the last part of the small intestine, and it ends at the ileocecal junction. It will continues with the cecum, that is the large intestine. Okay, now moving towards the blood supply and the nerve supply, which is very easy. How? The blood supply is very easy. Duodenum is supplied by, like I said, small intestine consists of three parts: duodenum, ileum, jejunum. So duodenum, jejunum and ileum. So duodenum is supplied by superior mesenteric artery, but if you can, please remember the branch of that thing, branch of this artery, that is superior and inferior pancreatico-duodenal artery. I am repeating again, the name is very much complicated, but the thing is, I am pronouncing that thing very slowly so that you can easily memorize. Duodenum is supplied by superior and inferior pancreatico-duodenal artery. Now what is pancreatico-duodenal artery? Like I said, it is the branch of the superior mesenteric artery. Okay, now venous drainage is through the superior mesenteric vein as well as splenic vein as well. Now ileum and jejunum, if I talk about ileum and jejunum, they are supplied by branches of superior mesenteric artery, same like duodenum, but the branches will be different, and the venous drainage is through the corresponding vein, that is the superior mesenteric vein. Last thing is the nerve supply of the small intestine, which is another the most easiest thing. there is sympathetic supply and the parasympathetic supply. Sympathetic supply is through the T9, T10 and T11 nerve, and the parasympathetic nerve supply is through the vagus nerve, which is also known as cranial nerve number 10. So this was the whole topic regarding the small intestine. Till then, work hard, study hard, and good luck. Take care. Bye bye. Thank you.